problems can get even larger for them. So let's talk a little bit about race-related stress as an adverse childhood experience. So, of course, right, we know about adverse childhood experiences at this point, even as mental health professionals, although a lot of times pediatricians, healthcare providers are often talking about adverse childhood experiences. And I think we see mental health professionals talking about it more. So, of course, these are events that occurred during childhood that have cumulative negative effects on an individual across their lifespan. I offer you this ACE pyramid. I really like this idea that really helps us to understand the trajectory and why it's so important for us to intervene during infancy, why dealing with perinatal issues are so important. So as you can see here, it goes from generational embodiment, like historical trauma, as I've mentioned. And you can see it starts at conception, social conditions, and then the regular childhood experiences. People rarely go through life without experiencing some form of trauma or loss. Grief also can be associated. And then, of course, disrupted neurodevelopment, thinking about the social, emotional, and cognitive developmental issues. And then health risk and the behavioral problems. And we don't often think about it, but even disease. So thinking about that. And of course, what we know from the research is that issues around, life expectancy are also impacted. So we think about long-term effects of ACEs. There are health issues, of course, obesity, liver disease, definitely COVID, heart disease, premature death, but let's focus on mental health problems. We think about depression and depressed mood, even hallucinations. I can't wait to hear from you about some of the things that you've been dealing with. I've talked a lot, of course. MAJ has a suicide prevention session that they offer several times a year. And I've talked about suicide prevention related to various groups. And so when we think about, again, infant and maternal mental health, we can make a connection to suicidal ideation and suicide completion. And then I already mentioned the issue around memory. So if I, think about just the US, and I have a few statistics today and tomorrow. So I've tried to cover Canada and Australia. I don't know if I have something on New Zealand. I see that. And the US. So I've tried to pull a few out. So this one is related to the US. And look at that, almost half of the children have experienced one ACE, one adverse childhood experience. And at least 10% have experienced 3 or more adverse childhood experiences. So you can imagine, that they would be in the high risk category. If you think about what are some of the most common ACEs, economic hardship. So, advocacy for definitely talking about how can we reduce poverty wherever we live. We know that there's a correlation between poverty and emotional, physical development. The second one also relates to the case illustration of Susie, right? Divorce, separation of a parent or a caretaker, guardian. And then if you think about multiple ways in which children might be marginalized, so not only issues of poverty, of course, children of color, new immigrant, and of course, how did they get here? Are they refugees? Also, LGBTQ youth, right? So also religion. So we could think of a lot of different ways in which children might be marginalized based on their status.